Right, we'll call the 2 o'clock meeting of the County Community Health Board to order. And I think what we'll do is just do it. We're all here. So could I have an approval for the agenda?
Mayor, I'll make a motion to approve the agenda.
Second,
Second.
all in favor, say aye.
Aye.
Opposed? Okay, there's no minutes necessarily, are there?
No.
Okay,
No.
all right, and discussion will. Mhm.
Okay.
Yeah.
Well,
Yeah, there for this.
you never know what kind of questions you gentlemen are gonna ask. I've been taught by the best. So good afternoon. I'm excited that the Community Health Board was agreeable to meet a little bit earlier so we could kind of tackle our Community Health Board agenda and topics separate of the board meeting. I just want to speak to you guys real quick, and then we'll move on to the key topics of our agenda. But when I was interviewing for this position, I was asked, what do you plan to do in your first 90 days? And my response was fairly quick, and it was pretty simple. It was learn. I want to thank the hiring committee and this board for giving me the opportunity to not to only serve the Health and Human Service Department, but the Public Health Division, but also our county residents. And hopefully as we make our way through our first Community Health Board meeting together, not that you guys haven't been together, but with me, it will be transparent that I have been true to my word. Not only have I taken the time to learn, but through these processes, opportunities to collaborate have begun to take shape. And so to kick us off, we have Megan Thule here. She's our manager for the Family Health Clinic, and she's going to get us started with an update on things that are going on in the clinic.
Hello, good afternoon. So today I'm just going to talk about 3 of our different kind of programs, just to bring some insight into maybe some things that we do that you haven't heard before, and then also some progress that we've had along the way. So the first one that I'm going to talk about is our home visiting program. I know most of you have heard, and I know that I've talked about this before, our HRSA grant through Sanford, and we're a network partner with Sanford, Red Lake IHS, Leech Lake IHS, and Scenic Rivers in Big Fork. And so we provide the home visiting component for that. It's a 5-year grant, and we're almost at the end of year 2 of that grant. It will end on August 31st. For those of you that weren't here previously, the HRSA grant is really unique compared to some of our other models. It's one of 4 of our home visiting grants that we use. It doesn't require an evidence-based program, and there's no real eligibility requirements. So it's available it's kind of a universal home visiting program, which has been kind of fantastic, because if somebody is feeling a need for it and the education and the support, we're able to provide that to them. Another really significant piece, so this grant specifically in the family they're served prenatally through 6 weeks postpartum. And then once they're done with that 6-week postpartum mark, we're able to, if we built that rapport and they want to continue, then we roll them into some of those evidence-based home visiting programs that go up to like 3 years old. But just wanted to highlight 3 significant successes that we've had, especially over the last year, and some are just even within the last month that have come up. The first one is the coordination of referrals and services with Sanford Health. Previously to this grant, we may have gotten 10, maybe a year referrals for home visiting. And in addition, they also, part of this grant, they hired a high-risk OB coordinator, and we are having weekly conversations with this staff at Sanford, which is just helping us to serve our clients in addition to them supporting their patients. The second thing that is just come up in the last month is Red Lake IHS has hired a high-risk OB coordinator as well, and we are just starting to streamline a process of referrals for home visiting from Red Lake IHS. This is new and precedented, and we have never had any referrals since I've been in here or for the last few years from Red Lake for these home visiting programs. So that's like huge. The third thing is that in the process of, or the plan, the identified goal was that we would serve 75 clients or have 75 visits within the 12 months of the year 2. I pulled some numbers yesterday, and we have admitted 44 families since last September, and we have completed 146 visits since last September, and we still have another month and a half to go in this year 2. So achieving well beyond what the current goal and expectation was. So we're really excited about that. So the second thing that I'm going to talk about is we have a program. It's for children and youth with special health needs. And so we, in collaboration with MDH, they send us any children, any newborn babies that are born that have a hearing screening that they don't pass at the hospital. They are reported to the state. Any infant born that has some level of identified birth defect, they're reported to the state. If those parents haven't done any follow-up screenings, or because they have to be rescreened within a certain amount of time, especially for the hearing, the state is then notified of that. We get a list quarterly of babies that are born with birth defects, and then also ones that did not pass hearing screenings and did not complete a rescreen or a follow-up with the provider. One of our nurses then gets this list and she makes calls out to the list of families, and she provides assessments. We provide them currently over the phone. We do not, unfortunately, they are, an option is to do in-home face-to-face, but we don't have the capability to be able to meet those needs at this time. But she's able to provide assessments over the phone, determining, early access for language, referrals to Help Me Grow programs, transportation support, childcare support, parenting support. And so this last quarter, we had five referrals, and she was able to assess 3 of them, to get a hold of 3 of them and actually provide full-blown assessments for them. So that is also something that's really significant. With the hearing and detection and intervention, we are able to get reimbursable dollars for those services. With the birth defects, there's 3 levels of low, medium, and high severity acuity levels for the birth defects. The majority, thankfully, in Beltrami County are on the lower acuity level. However, we do not get reimbursed for those outreach attempts or any of those screenings. So that's just something that we provide. And then lastly, I just wanted to talk to you about WIC. Our participant levels, so typically we serve between 1,100 to 1,200 participants per month. Leech Lake WIC program, unfortunately, was without a staff member. They had nobody to run the program going back to December 2022. And so they recently just did hire somebody, so that's great. But we were part of the support for that. And so we, luckily, with WIC waivers in place, we were able to provide some of that support over the phone. And so in May of 2023, our numbers went up to 1,316. So we jumped up about another 116 participants in WIC alone, just with helping to cover that piece. Another thing about WIC is that we are moving to in-person appointments starting August 9th. We've had the option to do them, but now it's going to be more of a, this is status quo. This is what we're moving forward with, and we're really excited about it. It's going to be a significant adjustment. A lot of the staff that have been in the office, including myself, have not been in there when there's been a full-blown 20 to 25 WIC appointments a day. So that will be an adjustment, but we're excited for that. And then the last thing that I wanted to talk about was the breastfeeding coalition. So Beltrami County Public Health facilitates the breastfeeding coalition in Beltrami County. There are 32 community members that are a part of this coalition. Partners include independent lactation consultants, members from the state of Minnesota, Red Lake providers, Leech Lake providers, Sanford Health, and True North providers. So the coalition holds monthly meetings, and there's often new guidance or recommendations that come from the medical community on what's best with breastfeeding. And so we noticed that there was there's in years past have been a real disconnect on messages that people are getting and what's best practice and ways to resolve certain issues. And so this coalition was created to kind of have a common message, common guidance so that everybody is teaching the same thing. And so that's been a great thing to be a part of. And then lastly, one of the things that they provide is the breastfeeding tent. So we set up it this summer. Right now it's 6 events that we'll set up and take down to have a place for moms to go at different community events to do breastfeeding. Oh, I lied. There's one more thing. So the farmers market is another thing. I know we talked about it before. We created a grab and go option for families to go to the farmers market. We facilitate partnership with Tara Lee Gardens, and we actually go and set up pre-packaged kind of produce in bags. WIC participants can come. We'll go through education on the different vegetables, and we'll also provide recipes. And it's kind of a quick kind of in and out and grab it, but also get them a little bit used to being a part of the farmers market and attending it. So that is all. Thank you. Any questions for many of you?
Any questions? Mr. Chair, first, thanks for the update. Glad to hear that there are partnerships developing with Red Lake and IHS. Kind of curious. I think over the last few months, me and my wife have welcomed 3 grandkids. So our household has been pretty busy. I'm just kind of curious, so what kind of follow up you guys do with new parents or that type of thing? Because in the past 3 months, we haven't heard anything from any, Sanford or like IHS or, I know in the past, nurses used to come out and do a well child visit, at least once within first few months of birth. But it's kind of curious, what has changed from maybe 9 years ago when I had my last child to now where I got my first grandchild. So kind of curious.
So yeah, so when currently, I mean, all the services are voluntary. They're identified or they're offered at some point. So if they're going through Sanford Health, I'm not 100% sure on Red Lake IHS's processes, but I know with Sanford Health, they're making an outreach, the high-risk OB coordinators making outreach calls. There's information in the packets that are given at discharge too. And really it's a matter of them giving us a call and then we are willing to go out. If there's something where the high-risk OB coordinator has talked to a client or a patient about it, or one of the OB doctors have talked to them about it, then they'll give us a call or they'll send over a referral form. But it's voluntary. It would be amazing to be able to just make contact with everybody that's had a baby, and that would be phenomenal. I don't know what's changed from 9 years ago. My guess is funding.
Yeah.
But in some capacity, we do though, like if they're identified as low birth weight, or like if there's a doctor order of some kind of thing, they'll send us a referral, and then we will go out and do kind of the weight checks. And we're getting a Billy Rubin scanner to be able to kind of, because a lot of times 3 days after birth, they'll need to come in and get that scan done to see about jaundice. And so we are going to have the capability to actually go out and do that in the home too, just eliminating a lot of the barriers. But yeah, the ability to really provide with every single, that would be phenomenal.
Yeah. And I think when we were at Sanford, there was a little confusion on what services, Sanford could provide or the county could provide, because, we got that folder of information, and I think it's really helpful. But I said, well, we live in Red Lake, and, can we access these services, that the county provides? And they weren't too sure. So.
And I think part of it is just the development of the program. And I think just becoming more familiar in the community too, where people are actually talking about what's available. I think that's going to be part of it. I know Sanford is working with us, a big marketing kind of, and so hopefully with that, the program itself is called Families First. I call it HRSA because that's just where it started, but the program itself is called Families First. And there's gonna be a really big push for marketing for that in the third year. So I'm hoping with that'll open up where people are more aware of it.
Yeah, well, and I appreciate the update because I feel like I'm fortunate to be in the position that I'm in where, I get these continuous updates, but there are some in the community that they may not know. So, I mean, I think messaging is important and working on the partnerships is a great way to go forward. So thank you.
Yeah. Yeah, and I think for me too, like even moving forward, some real outreach to even like what services we really do provide. I think people see the immunizations or the vaccines or the WIC, but there's so much more that we do. So that just to become familiar that they can contact us and see if we provide it. I think
And
that's
Megan,
part of it.
yeah, I think we can also do an article, or you folks do an article for our next paper that goes out, it goes out quarterly. And just having an article dealing with what is being offered, I think just triggers some thought for people.
Yeah, no, I agree. That sounds
Okay,
good.
sir? Mr.
So
Carlson?
I had a question, Megan. You mentioned a couple of times a child that doesn't pass the hearing test, and I thought that was I was curious about that.
So when a baby is born, they do an automatic hearing screening at the hospital after the baby's born. And so sometimes that's amniotic fluid, sometimes there can be different reasons and sometimes it's congenital, effects that cause it. But so the recommendation is that they're re-screened after a certain period. And so if they haven't gone in and saw the provider for the re-screening, if they go in for the re-screening, then the state is notified and then they're taken off this kind of, follow-up list. And so if they haven't gone in to see a provider, that's when we get the list. And then we make the contact to try and help support them to have the child re-screened, make the referrals to any special needs services that they may need, that kind of thing.
So I guess I'm just kind of curious of all the things that could go wrong for a baby. The hearing seems to be an emphasis, and there must be something underlying that I'm not.
It's a huge, determining factor on their language, their social development, their, as far as their healthy development moving forward. If they're not able to hear at the same level as say another child, it's going to affect their ability. And so catching it early, like that's the goal, is to catch it as early as possible so that they can start getting the supports they need so that they don't fall behind and that they have access to everything. So, yeah. All right.
Mr. Chair, just not a question for Megan, but just on our agenda, we had a number 4. Are we going to save that one for the end to discuss, how the frequency of our community health board meetings and this new layout, so to speak, or?
We could do that right now. If you want.
Sure. Do you, would it be okay if I finished with item 1 on our
Yes.
agenda?
Sure.
Okay. So Monica spoke about 4 of the topics under the summary statement, and I would like to finish off by talking about our lab in the clinic and also trending topics that we're seeing in the clinic and under public health and as part of our community health. So the first thing I want to talk about is our lab. First of all, we have to have a certification of waiver, and it's called CLIA. And that CLIA waiver allows for us to appoint a director over our lab and be able to do lab testing right in-house, which is a huge service to our clients as they're coming in. The services that we provide through that lab include UA screenings. So we do drug screenings through the urine, we do a sweat test. We recently also started doing testing for fentanyl. So we do a preliminary test here, and then we send that out for confirmation. We also do lead and hemoglobin testing, and that's primarily done with our WIC patients. And the hemoglobin test, they do a finger stick, they put the drop of blood in the machine, and it gives them a result right away. What's really awesome is that our lead process used to take 2 to 3 weeks to be able to get our results back. We would send a drop of blood in as a sample. Once we would know if that baby or that child was registering high for their lab level, which used to be 5.0, we would have to make contact and ask them to come back in or try and do phone screening. Well, we found that there's a machine where we can get our lab level back for lead in 3 minutes. And so now our staff are able to do the hemoglobin testing and the lead testing right in-house and provide real-time face-to-face education and any kind of follow-up that they would need. A couple of things that are really nice about this lead machine is that it's mobile. So we have the potential for taking this with, for example, if we're going to Head Start and we were doing some preschools training, we could also take that lead machine with and do screening for that. We're anticipating an increase in higher levels of lead readings or results in our children because state statute passed a new law that the level is now going to be dropped to 3.5. So we're anticipating that we may see an increase in our children that are testing high because of that. One of the things that we cannot currently do in our lab is testing for STDs. And so I use that as a nice bridge into my next topic of trending topics. The reason that we can't test for STDs right now is because we don't have an NP or an MD on site, and we would need that to have that service in order to do any kind of STD testing in-house. As you can see in your packet, in the attachments, I've included some data related to STDs in our state and in our county. A couple of things that I'd like to point out to you is that since 2018, we've seen 131% increase in syphilis in our state. It's pretty huge, right? And of that, 44% of them are Caucasian, 29% are Black, 9% are American Indian, and of that, the greatest population actually falls in our teenage years. So from 15 to age, and then they break that all the way up to age 30. But our highest population is really in that 15 to 20-year age. The reasons that we're seeing for an increase in this is because people were not seeking healthcare over the last couple of years. And so they weren't getting treatment. But a lot of it has to do with lifestyle and having high risk lifestyles. So having multiple sex partners, men having sex with men, and also moms passing it on to their babies. So while men have the highest statistics of syphilis right now in our county and in our state, we're seeing an increase in women and women giving it to their unborn babies. I'm not going to read all of the statistics to you that are in your packet, but I think one thing that Sarah Levitt, our epidemiologist, wanted to point out is that if you would like a more in-depth session or conversation regarding any topics related to STDs or that are relevant to as an epidemiologist, she would be more than happy to come to one of our community health board meetings and do a presentation. And then she just sent me an email and she just said she wanted you guys to know that while it's largely behavioral driven for our risk, such as unprotected sex, multiple partners, she wanted to point out that also that can be influenced by other factors such as substance use, sex trafficking, or sex in exchange for works or substances. So just a little bit of data to give you on some hot topics. And then under the hot topic, I also had the topic of Mpox, vaccinations, suicide, and xylazine. Today, I'm not going to talk much about vaccinations and Mpox, but I did include a handout for you on suicide rates and the increasing rate that we're seeing. So in one of the events that I traveled to, I learned that 1 in 5 youth have contemplated suicide in the last year. I have also been asked to take Mercy's place on the HAS meeting. It's HAS stands for Headwaters Alliance for Suicide Prevention. I can't tell you much because I haven't attended a meeting yet, but the next meeting is in August. And the intent of this group is to provide community collaboration, prevention, and support for local agencies. But it doesn't just impact our region, our county, but it impacts our region. And so like Hubbard County is a part of this. And I think there are 2 other counties that are also involved in this collaboration. So this group is really working hard on prevention of suicide. One of the things that this group also does is the annual run, walk, skate. And just due to COVID and everything kind of be putting at the, at the wayside, they haven't been able to get that up and running, but that is on their agenda and they are hoping to get that going again, because that was a very beneficial way for the community, for them to reach out to the community. And so, yeah, I don't think I'm going to read any of the statistics to you guys, but I just wanted to provide that for you. So that is number one on our agenda.
Great.
Mr. Chair. So I would be interested in maybe learning a little bit more from the epidemiologist about, some of these things. I mean, I think it's a concern that that the younger generation, has such a high number of this STD and I think it could be preventable. I'm not too sure what happened from the time that I was growing up to today. I don't know. I mean, I know that times change and people change, but I mean, it's just I think it's alarming to hear, the lifestyle that this younger population is engaged in, and knowing the effects that it could have on, a person, long term is, I mean, it's concerning. And also, you mentioned the tests and things like that. Are these billable services through medical assistance, or how are you guys making sure that people are signing up for medical assistance and things like that?
Are you talking about for STD
Yeah,
testing?
STD, you talked about the lead testing, all these tests that you provide.
Yeah, so our testing is billable. I could let Monica speak to that a little bit more because that's done through the WIC program. But currently, I'm going to say like Sanford Healthcare, Walking Clinic, or ER are the places where people can go in our community to get the STD testing.
So, yeah, so the lead testing is billable for us. We can bill medical assistance, Prime West or Blue Plus. If they do not have medical assistance in any form or fashion, we use our local public health grant to help kind of fund the costs for those that don't have insurance, to be able to ensure that they're still getting screened. Yeah, and there's different partners that we work with. Head Start in Bemidji, they have some funding to help cover the cost of it, and they require for all of their students to have that done. So they'll be funding some of that cost, like a sliding fee scale as well. So, yeah. Good question.
All right.
Any other?
Yeah, Mr. Chair, just is most everything with the family health clinic, is it all mostly women, infants and children oriented? I'm just wondering if there's any emphasis or anything for elderly and for their care. And, when I first saw home visits, I didn't know if that was who that pertained to. Sounds like it's mostly just for babies and infants and that kind of thing.
Yep, so through the clinic services, our primary focus has been right now on women and children. Outside of the drug screening testing we do, that covers a gamut of people. Services for elderly are covered under the social service department. That is the managed care is one of those departments. And if you recall back in, I think, April, we moved that department under Jeff Lind in social services.
So they do similar stuff, just in a different department.
I believe so. Actually, Mercy actually oversees that department. So if you'd like her to.
We'll probably
speak about
get to her here. So
Yeah.
So thank you.
Great. Move on to the next topic.
Okay.
We're done and then decide based on how this.
Okay.
Oh, now the pressure's on.
Yeah, so now performance.
Yeah.
All right. Put my game face on. Okay, so we're moving this one. I'm gonna make sure I stay on top. Okay, so then we have partnerships. So There are two primary topics that I want to talk about under partnerships, and then there is also an exhibit attached, and that is a document from MDH related to xylazine. But the first topic I want to talk to you about is our collaboration with the Northwestern Minnesota Juvenile Correctional Facility. And so in part of kind of reaching out, trying to figure out like who community partners were, the director of that program reached out and said, hey, we have a state statute change. We need TB testing for not only all of our residents, but for all of our staff. So where we're at in that process is I've kind of formulated a plan with Monica and our team and what we could take on for services and what we would be able to provide for that team. And we're working on a contract right now. And the contract would basically allow for us to go in as needed, but we're looking at doing it every other week on a Wednesday. We would go in and do TB screening for their staff and for any new residents, because their residents have 14 days from admission to get screened, and they do not have a full-time nurse or healthcare provider that can do that service for them. In fact, they have a nurse that comes in once, I believe, every week or once every 14 days to do the health assessment that's required by the state. We would train them on how to read the TB screening test, so we would not have to go back and follow up with that piece of it. And then we would, in our contract, we would have a fee for service that would not cost the county anything out of pocket. It would cover the cost of the nurse going and doing the test, and it would also cover the cost of the medication and all the supplies that we use. So that's one collaboration that we're working on. Do you want me to pause and offer the opportunity to ask any questions regarding that topic, or should I talk about our other one?
Maybe have ask questions. Yeah,
Okay, sounds good.
and this is what the Northwest Juvenile Training Center.
Juvenile Detention Center. Yep.
Right.
And then the other collaboration that we're working on is with Beltrami County Schools. And so another new state statute is requiring all schools, private and public, to carry 2 doses of nasal Narcan on hand at their schools. And so the first school to reach out to me was actually Schoolcraft. And they said, what are we going to do? And how can you help us? And how do we obtain this? And so I spent some time visiting with him, and then I formulated an email reaching out to all of our community schools, including early childhood schools, elementary schools, middle schools, high schools, and even Concordia Language Village. And I just offered them the opportunity if they would be interested in collaborating and working on something that would help them all attain and meet this new state regulation, right? And so what we came up with is I'm collaborating with Greater Northwest EMS System and then the Beltrami County Sheriff's Office. And what we would like to do is provide a 2-hour training session, and we would offer it at different times and open it up to the schools so their staff can attend when it works for them. And we can provide this training at school sites. And the training would include teaching them about how to use an EpiPen, how to use an AED, how to really be that first responder, especially in our rural schools where it might take a while for an EMS person to show up. And then we would talk about how to use the naloxone, and when it doesn't work, it's possible that they might be experiencing a xylazine overdose. And so in your packet, you'll find some information about xylazine, but essentially where you administer the Narcan and it reverses the effects of fentanyl or opiate, xylazine will not be impacted by that. And so what's really important for our community to know that if you come across somebody and you give them Narcan, it doesn't mean that they have passed away. It could mean that they have used something that was laced with a xylazine. And what you need to do is do mouth to mouth or provide that airway support. And that is one of the hardest things to teach right now, because first responders or like through your first aid training, everything is being taught compression, compression, compression. And so we really feel this training would be an invaluable tool to our community schools. And I believe that there will be other organizations that would be interested in this training too. Like, for example, the Homeless Coalition, their team staff are very interested in having this type of training. So just so you know, Schoolcraft, Black Duck, Kellier, Concordia Language Village, Trek North, and BICAP Head Start are interested in collaborating and receiving the training. Apple Blossoms and AWOCL are still thinking about it, and I have not heard back from Voyagers, Red Lake, or a couple of the smaller preschools in town. And the biggest, I'm going to say, hiccup isn't getting the Narcan, because EMS will, the Greater Northwestern EMS system, they will actually provide that for us right now while they have that available. In my opinion, I think one of the biggest hiccups is going to be getting that provider signature. And so what I want to look into is creating a contract with our schools, with our rural schools that are interested in partnering. And what they need is a medical director. So just like our community health board has a medical director and he signs off for us to administer like our immunizations, for example. I know that public health agencies can have a contract with their medical director, with their schools that allows the public health agency to carry that contract and that signed document that says that the staff at that school basically have permission to administer that medication like Epi or Narcan. So that will take a little research on my part, how that works in Minnesota, because my experience of having something like that is North Dakota, and it might be a little different here. The last thing that's not on your agenda is I just wanted to let you know that I'm also partnering with Sanford Health for a conference called Many Faces of Community Health for 2023. I submitted an abstract to present on Eat, Sleep, and Console, a way that we're managing infants that are exposed to opiates or substances during pregnancy. And the reason that we're collaborating with Sanford is because the majority of the work that I did while I was at Sanford was successfully implementing this program. But it collaborates with public health and the home visits that we're doing, for example, like through the HRSA grant that Monica talked about. You know, if we have an infant that was impacted by an individual who had substance use disorder, we can work with them in making sure they're meeting their milestones and any struggles that they're having with bottle feeding or breastfeeding, because latching on is often a huge difficulty for these little ones, and then they're at risk for failure to thrive. So those are my 3 updates on partnership.
One of the topics you hit on the last, there used to be a collaborative between Prime West, Sanford, and Red Lake dealing with babies that were addicted as well. And I'm sure this is probably an offshoot of that.
I'm not familiar with.
Anne, are you familiar with that?
am familiar with that. And we're still doing that in collaboration with Sanford, only the grant changed a little bit. I think Red Lake bowed out of it a couple of years ago, but we do still work one-on-one with moms who struggle with opioid use. And then we also provide case management for them for up to a year, I believe it is, after they've had their baby. So we do have that. Cami Kelm is the social worker who does that program. And that is under Jeff Lind.
Okay. Yes.
If I can follow up, I know a number of years ago, you know, the statistic was really high. Where are we with
Number of babies.
You know, I will have to get back to you on that.
Okay.
I will have to check with Sanford. on
Yeah, I was
that.
just kind of wondering,
But it's like.
okay. So I was just wondering, has that program had an impact on reducing the babies born addicted or I was just kind of curious where we're at.
We'll have to get back to you with the statistics, Commissioner Sumner, but I do want to say that we've seen some amazing success stories come out of the work that Cami has done. And we're really proud of that program. So if the board is interested, we could certainly have a report around that particular program come back.
But I think this one would be a meeting that would be separate from the community health because it's under social programs that would be under Jeff.
Could just be a work session.
Yeah, yep, okay.
Mr. Chair, did you mention Gregla School District, Amy?
Excuse me?
Did you mention Gregla School District?
I'm not familiar with that school. What?
They're not in Beltrami.
Well,
County.
Don't they have
Mr. Chair.
6-8 townships in northern part of the county?
Yeah, Mr. Chair, Commissioner Gould, I'm glad you brought that up because, you know, when you're listing off the school district, I was wondering about the Grego School District. Yeah, the Grego School District isn't technically in the county, but we do have students and families that utilize that district, and I believe they may be even they may receive some funding from maybe the PILT or CONCON as a school district. So it's
I'm not,
FYI.
yeah, and I'm not sure how governmentally that's incorporated, so.
Are you asking me to include that school in my?
Well, I'm looking at the map and it's mostly in Beltrami County. There's some that are in, there's some part of the school district that looks like it's in Marshall County. But it looks like most of the school district boundaries for Grigla are in the northern part of Beltrami County.
Could I be so bold to ask you to spell that for me? I'm not familiar.
GRYGLA.
Thank you. No,
Yep.
that one's not familiar to me, so
Okay.
I can tell you, I kept a spreadsheet of all the schools that I reached out to, and just to preface, I did connect with Bemidji Public School, but they have Ms. Helm, who oversees their health system there in the schools, and she and I had a conversation, and she said she would take care of any schools that fall under her preview.
Okay, well, be worth checking out, I'd say, and
Okay.
probably looping Commissioner Sumner at least into what you find out.
Hopefully you find out that Marshall County, because of the school proper is physically in there, they're already taking care of it, but.
Yeah, the building itself is in Marshall County.
Okay. And are we, which is the next topic?
So the next topic I have is training and conferences.
Okay,
All right. So today I have Mercy White here with me. She's the manager for managed care, and she's here to speak about her opportunity that you guys blessed her with to attend the 2023 Preparedness Summit through NACCHO.
Hello, everyone. I know we had referred to it, yes, as Nacho. We were excited about that when we came and asked for permission for me to attend that conference. So I'm just coming back today to kind of report back on some of the key takeaways. I'm not going to do a deep dive into what I learned, but I am going to kind of give a high overview. And if you have specific questions, you are welcome to ask me them. So the focus of this training was on a One Health approach, and to kind of explain what that means, it was looking at the human, plant, animal, and environmental health as a whole. And so making sure that we're looking at a whole holistic One Health approach. The theme of this conference was recover, renew, and reconnect. And so reconnect was really a big emphasis after COVID. We were all super separated, and as we are seeing just across the board, everyone is craving that reconnection. So that was a big focus of this training. So to go over some of my key takeaways that I got from this conference, just the importance of community outreach and relationships. Again, that goes back to that reconnect, having that relationships with our community, being creative about how we do our outreach. So tapping into some of our smaller communities, for example, like churches, townships, councils. And so figuring out where are those places in the community that people have those relationships in those communities and who do they trust? So we can tap into that for some of our outreach and bring that outreach directly to them in a place where they feel comfortable. Another thing that we talked about was just the importance of community trust in regards to our emergency preparedness messaging. And so what I mean by that is having unity in our county across the board, as well as the public health department, and making sure that we do have clear messaging on what our emergency preparedness plan is, so that our community is trusting that messaging that is going out to them when we are in an emergency. Another thing that we talked about was just the importance of presenting hope and acknowledging community resiliency. So this really came out in the fact that when you're looking at emergencies, you're often looking at what are the needs of your community, but it's also super important to also look at what are some of their strengths, well, how are they resilient, and what can you tap into that when you're looking at some of those emergency preparedness plans. So making sure that you're looking at the needs, but also looking at the strengths and kind of building that together. Another topic that was talked about was just the importance of cultural humility and cultural norms. And so not every single community's emergency preparedness is going to look the same. It's really going to depend on your individual community and what their cultures are, understanding that those emergency preparedness plans might look different. This was brought out, especially when we think about working with our tribal partners, making sure that we are there to be a partner with them, support them, but also respect if there are differences in how we handle an emergency. Another thing that was talked about was acknowledging the mental health impacts of a disaster. So disasters are not just going to be physical impacts or environmental impacts, but we look at COVID, for example, and there's a lot of mental health impacts that we are going to see for a long time. And so making sure that we really are being mindful of some of the mental health impacts that happen in an emergency. Another topic that was really brought up a lot was just the intentional focus on tribal relationships. So if we look at our community, making sure it's not with just Indian Health Services, but with the tribes as a whole. There was really an emphasis on taking the time to have those face-to-face meetings and conversations and seeing what you can do to assist, and not giving directions, but being available to be supports and help the tribes through some of the barriers that they face. The last thing that I wanted to touch on was the importance of community access and doing the work in the community. So making it convenient for our community. So what that means is, you think about Beltrami County, it's very, very big. Oftentimes we have individuals come to us for the services that we provide, but how can we go to them and make those services as accessible as possible? So those were just a few of my big picture takeaways that I wanted to bring back to you guys. And again, just wanted to thank you for the opportunity for me to go to this conference. It was a really great learning opportunity. I had some time to talk with both Amy and Monica about what I learned and how we can bring that back to Beltrami County in our own emergency preparedness plan. But at this time, I'm just going to ask, are there any questions for me?
I just am glad that you reported back. Sometimes we give them, say that's fine to go and we don't hear about it. So
Yes.
It was refreshing to hear your take on it.
Well, thank you for having me.
Craig?
Mercy, did you ever had any collaboration with Chris Muller at all? And I know he has been kind of the dual role emergency management person, and just wondering if you had any discussions with him before or after the conference or anything?
I did not specifically with Chris Miller. I did speak with Amy, though I know she's had a lot of conversations with Chris. And so I kind of brought the information to Amy to therefore kind of take what she thought was important to talk with Chris about.
Okay, thank you.
Yeah. Any other questions?
Anyone else? All right, thank you very much.
Thank you.
Thank you, Marcy. Okay, so there were 3 conferences that I attended, or trainings, and that took me out of town. St. Paul, I went to MDH's orientation for public health directors. And during that meeting, we also collaborated and learned about how SHAC, public health, and MDH work together. I'm going to talk a little bit more about what I learned from that specific event during the topic when we talk about legislative updates, because I feel like it's more important to put it into that category. Then I went to the Duluth LPH annual retreat. And during that retreat, we talked about public health and emergency law. And I'm also going to talk a little bit more about that in depth in the next presentation. And when I talk about how I've been collaborating with Chris Muller as part of overseeing the FEP grant and the work that we do for emergency preparedness and public health, but how that overlaps with Chris's role in emergency management. And then of the last 4 weeks, only one of them have I actually been here. And so the last one was just this last week. I had the opportunity from your guys' permission to attend a conference in Washington, DC. And that was part of and funded through that HRSA grant that we have in collaboration with Sanford. And there's one really huge takeaway that I want to share with you guys. It was from my favorite speaker. His name was Dr. Warren. And he works with Indigenous people, and he is from South Dakota, and he now works at the federal level. And he tells a story about how there were 3 Indigenous women. They were walking upstream, and all of a sudden they noticed that there were babies floating down the stream. And the first lady said, "Oh my goodness, we have an emergency. What are we going to do?" And the second lady said, "No, hang on. We need to teach these babies to swim." And the third lady said, "No, you're both wrong. We need to ask the question, who's putting these babies in the stream?" And so I really took that to heart, because that drives me for who I am as a person, but who I am in this role and as a member of the team, right? And that we ask those hard questions. Like, we can look at something and see that it's an emergency, right? We can look at them and say, we need to do teaching and education. But what we really need to do is ask, why were those babies being put in the stream to begin with, right? Why was that road put up? Why was that fence put up? And ask those hard questions, so we can get down to the root of what is causing that end result of the emergency. So that is all I have for you guys. There is an attachment on here for talking points for SHAC that we were given at the the director's training in St. Paul. But I want to talk more about SHAC and in terms of legislative updates, if that would be okay with you. And so that ends my portion of number 7 for training and conferences.
Okay, yeah. Just a reminder, we need to be done a little before 3.
Okay.
So we could, if you want to move something to another meeting, for whenever we have that. Is there a priority? I know the opioid settlement, they're looking for a committee.
Yes, I would, if we have to table something to another meeting, I think the legislative updates I could table.
Okay.
Because I basically kind of wrote out a highlight of those
Right.
legislative updates. And I'm guessing that you guys are probably well educated and getting tons of emails on those. I just wanted to highlight the ones that were important and going to impact our county.
Okay, and we can do that in the pike.
Okay.
How about, which one do you think is the most important?
I think the opiate settlement was, because that one I do
Okay.
have a recommendation.
All right, let's move to that. please.
Okay. So as you can see in the recommendation portion, is I am recommending for the approval of forming a steering committee. I'm recommending for the appointment of a CHB member or a commissioner to be part of that steering committee. And I have a recommendation to move all of the opiate settlement presentations to the Beltrami County Board work sessions or regular meetings. So that would remove that off of CHB updates. And the reason is because that money is actually housed in the county. It's not part of, it's kind of complicated, but it's not really part of the CHB, right? It's part of the county's funding.
Mhm.
And so in your packet, the first piece of it is we have a group that has been meeting. That group is of 9 individuals, and that they're actually listed on the suggested members of Beltrami County. And then what we would like is for this set of guidelines to be blessed by you guys, that we can use these to guide a steering committee. What our intent would be is we have put together a proposal for sending out if you would, an application for a letter of interest for our Beltrami County. Anyone who works in Beltrami County, the county of Beltrami,
or anybody who lives in Beltrami County. We would like to seek up to 15 individuals, counting the 9 that we already have been meeting with. So it would be an additional 6 individuals. And that 9 would include one of the commissioners or the community health board member. Okay. And so first things first, if you've had a chance to read over the opiate settlement steering committee guidelines, we would like to move forward with using this. And then we would like to recommend our group that you guys appoint one of you fine gentlemen to sit on that committee with us. We meet the second Monday of every month at 2 o'clock. The intent of the steering committee is outlined in the objectives and the goals of this document.
Mr. Chair, I would recommend that we ask each of the commissioners if maybe there's someone that really has a desire to be on there.
Right. Is there any one of you folks that would,
Oh, Mr. Chair, I would be interested in serving on this committee if there are no others. I mean,
anyone else?
I nominate Commissioner.
Okay.
Second.
And could we have an alternate as well in case Tim can't make it, so that would an alternate work or not?
Yes, our team has talked about that, and we would be in approval of having a alternate from the commissioners.
Is there anyone that would like to be an alternate?
I think we can all be an alternate on any
Okay.
committees. So, I mean,
Just feel free to
Yeah.
check with us. Okay, very good.
So with that, I should have probably done this in the opposite order. I would like to recommend that you approve the formation of a steering committee, which Commissioner Tim Sumner sits on.
So, Mr. Chair, I make a motion that we adopt this steering committee.
yeah,
Oh,
I was
that's
gonna
right.
say if we can move this
We
to
could-
the
We can move it.
regular.
Well, now we can actually make, now that we've changed the format, we can actually make a motion.
Because it's a,
Because we're making this a separate home meeting,
This is
which is actually the purpose of why he did this in the first place.
Okay.
So,
so I move that we adopt the
Guide-
committee the way that Amy has it laid out for us.
Steering committee,
Steering committee.
guidelines?
Yes.
Okay,
And also that Commissioner Sumner would be our commissioner-elect for the.
Okay.
And I'll second that, and also that we would add the 6 community members that you would go through a vetting process, and
Correct.
so we'd have a total of 15 on the steering committee.
Yep, up to 15.
Up
If
to
this,
15.
yep, if the steering committee didn't have 6 applicants or find 6 applicants that would be productive to the team could decide that.
okay. Is any discussion?
Mr. Chair, how would we include this on the committee list?
Oh,
Would that be
and good
separate?
Point, Tim, I was actually gonna bring that up about that we want to have this on the approved list for the Indians, so
Does that have to be a second?
we probably need to do that in our
Regular meeting?
Motion,
Okay.
regular
Okay.
meeting.
Yeah, because that's actually a county board
Right,
decision.
so remember.
Yep.
Okay. All in favor, say aye.
Aye.
Opposed? So moved. Okay, I think we've kind of reached our end here, but I like this personally.
Yeah.
As a commissioner, I like this form that where we have the full hour, because there's always seems like before it was cut off and not as structured as what it could be. But that's me.
Yeah, Mr. Chair, I was kind of concerned. I was wondering if hour was too long. But knowing that, well, I could have held some of my questions, but, you know, I think an hour is good.
Anyone else?
No, I think that, I like the new format. I think that, we should stick with quarterly and. He's gonna read that part and. Ask him to do.
I do want to make sure that you gentlemen don't miss on the bottom of the opiate settlement funding agenda bill to save one of or both of the 2 dates for October. That will be, we're required by the MOA of the opiate settlement funds to host a community learning session or informational session, and we're going to do both, and we're going to do it twice to make sure that we have our community members have an opportunity to engage. The one on the 24th will be here in town at the Beltrami Electric Building in the evening. I do not have a time set, but the building is reserved for the evening. And on the 30th, we will be at Black Duck at their golf course. And again, that will be in the evening. Okay. Okay, thank you very much for having me and accommodating this time.
We have a motion to adjourn. Second? Second. All fair, say aye.
Aye.
Opposed? So moved.